I'm Rachel Pope. I'm a gynecologist and I'm the chief of the Female Sexual Health Division. I got to UH originally as a resident in OBGYN, and then I left for fellowship in global women's health, which actually brought me to Malawi in Southern Africa. I was there for 2 years as a fellow, and then I stayed on as faculty for 2 years with Baylor College of Medicine. My family and I made our way back to Cleveland, and I fortunately got to be part of the beginning of this division of female sexual medicine, female sexual health. So, female sexual health is the study of the science and medicine behind sexual function for women. We see that there are fluctuations in sexuality throughout the lifespan where different issues might cause problems, such as pregnancy and childbirth, menopause, and different disease states such as cancer. There is a burgeoning field within female sexual medicine as we continue to ask more and more questions and continue to look for answers. It's unfortunately a neglected area of study, but in the last couple of years, I would say there's become a lot more attention garnered around the topic, and this is really helping our field advance. We're learning more about the inner workings of female sexual health from a biopsychosocial model. My area is in the medical aspect of things, the physical, the anatomical aspect, and that also takes us into the surgical aspect and looking for advances of making things better for women, especially, for example, after cancer. If a woman has experienced radiation damage or injuries because of surgery she needed to have to fight cancer, she might need a reconstructive surgery, for example, so that she could have a functional sex life again. That's just one of many of the areas that we take a look at or that we try to provide care for. In the last year, a lot of attention has come to menopause as we've had more and more research showing that female sexual health is really comes to more challenges, more barriers during perimenopause and menopause with fluctuations of hormones and decreasing estrogen and testosterone. And fortunately, a lot of research is starting to focus in this area. We're learning more about treatment options for women the more we understand what is actually causing the problems. So our team is made up of an interdisciplinary group. We're so fortunate to have someone as experienced and pioneering really in the health of female sexual medicine as Dr. Cheryl Kingsburg, who is a psychologist, but she is in the behavioral health division within OBGYN, and she has a secondary appointment in urology. So she and Dr. Erica Kelly lead the psychological component for us with the female sexual health division. We also have clinical specialists in vulvar dermatoses, vulvar conditions, and gynecological conditions with Jean Marino, nurse practitioner, and bladder conditions, and also vulvar conditions with Anna Myers, who's also a nurse practitioner with a urology background. Our team altogether, also including Karen Connor, who's a pelvic floor physical therapist, meets with each other once a month to go through difficult cases and set up referrals to one another, as we know that female sexual health is multifaceted, and so a team approach and a multifactorial approach is necessary to really address the biopsychosocial aspects of female sexual health. This past year, we were so excited to host the first ever female sexual health symposium in Cleveland, Ohio, and the topic was female sexual health and menopause. As I mentioned before, female sexual health does really start to become a challenge for many women going through menopause. And so we wanted to highlight that, get the word out, get people talking about it, starting conversations to talk about what the issues are and start looking for more answers. We had world experts come to Cleveland for that event. We had CME available for providers for the event. So we were really fortunate to have a great showing and event just here in town in Cleveland, just to talk about female sexual health and menopause. We do hope to do this symposium regularly. So we are planning to do a symposium next year focused on the pelvic floor. The title will be Demystifying the Pelvic Floor, and we hope to have some hands-on skills building as well as didactics for a day-long symposium type of workshop. We are also working on a few different research projects together. A couple of things we've already done. We were fortunate enough to get a grant this past year to look at lichen sclerosis and menopause, as we know that the symptoms for lichen sclerosis unfortunately get worse with menopause and declining estrogen. So we are now putting together manuscripts and presentation posters for describing the findings that we got from that research. And we're continuing to work on new research studies together. The other exciting thing that happened this year is that we did all put our heads together and we wrote a book called Sex in Your 60s. And you can find it online. You can find it on Amazon and in a couple local bookstores here in Cleveland. So we hope to continue writing together, continue doing research, and complementing one another with our interdisciplinary skills in 2023. I think it's very exciting that we are part of the gender affirming team as well. So I'm the gynecologist on the team. I help with the vaginoplasties. I do the vulvar and the labial aspects of we could call it the vulvoplasty part of the vaginoplasty. And it is, I'm very happy to also provide the gynecological care afterwards and have my colleagues in the female sexual health division help with the sexual function components too. Several of our patients have needed some assistance with sexual function and been able to refer them to our psychologists on our team, to the gynecologists on our team, et cetera, and also to the pelvic floor physical therapists as they help with dilation, which is necessary for many of our patients after a vaginoplasty, especially if they need a little extra assistance. So we are very fortunate to be part of the gender affirming care team as well. And it just goes right along with female sexual health. That is, when you're having a reconstruction done of your genitals, then, you do need ongoing medical care for them. So having a multidisciplinary team to provide that care is I think really sets us apart. There are many patients who see multiple of us from the division, but I have a few who really have made a point to let me know how grateful they are for our division and how grateful they are to have those of us that they're seeing, so they might see Jean in gynecology, they might see me to follow up on some surgery, and then see Karen for pelvic floor physical therapy, and they might see Cheryl for psychology. Literally, I have several who would see up to 4 of us at different times. And in our office, we have our flyer kind of introducing the new division with our photos there. And so I've had a few patients who look at that flyer when they're in the office with me and just tell me how grateful they are and how happy they are that they can see all of us. And they've told us, oh, I just love you guys, and you guys have saved my life. That was one patient I saw a couple weeks ago. And that just made me feel so good that we can truly give care and provide care as a team with our individual strengths, and our patients are noticing that.